Welcome to my channel. For this podcast, I had the privilege of interviewing Dr. Paul Anderson on the topic of mast cell disorders and histamine intolerance. This topic was really personal to me because I suffered with it for several years, a few years ago, and I only finally healed from it using a combination of extended water fasting and diet and lifestyle modifications and no medications. So I wanted to talk to Dr. Paul Anderson about kind of the underlying mechanisms of why that could have occurred. And he's thankfully shared his knowledge, which he has gathered from years of experience of working with patients with complex illnesses, where they were also presenting with mast cell and histamine issues. So the purpose of this video really is for information purposes only. It's not to replace the need for a doctor or physician. So if you are suffering from mast cell issues or anaphylaxis, then you really need to get urgent care and go see your doctor. I just want to also say that it's worth remembering that everybody is unique and bio-individual. So just because the water fasting worked for me, it doesn't necessarily mean it's going to work for anyone else. So this video isn't to tout the benefits of water fasting as a way to heal mast cell. Everybody, because as I say, it worked for me personally, and I just wanted to share my story. And I hope you find some of the information that Dr. Anderson shares quite useful. And maybe there's bits of information that you can maybe adopt or take note of that might be useful in your particular situation. But I hope you like the video. If you do, please like and subscribe and feel free to leave a comment down below. Thank you so much for watching. So, as I understand, you're an internationally renowned naturopathic and integrative doctor. You specialize in lots of different complex illnesses, which have spanned over 3 decades in your career. Can you tell me a little bit more about that?
So the practice is involved with fairly intensely ill folks sometimes. Um, Over the years, there are things such as, we're going to talk about today, for example, that we certainly had patients have these problems 10, 20, 30 years ago or more. But there weren't names. We didn't categorize them like we do now. So there's a lot of things that, if you've practiced a long time with people who have complex chronic illness, you've seen these patterns. And then as they become better outlined by diagnostics and maybe better incorporated into the fabric of medicine as an entity, you look and you say, oh, well, man, I've been treating people with that for a long time, but we didn't know what to call it. And so that's happened with lots of things like SIBO or SIBO, a lot of the autonomic dysfunctions that we now have better names for, certainly mast cell and histamine response problems. So those have been, and because those are part of complex chronic illness, those have been at the core of so many of my patients' issues over time, that I have just kind of kept track of what worked, what didn't work. And now, although I still practice, most of my time is spent trying to educate physicians about these things. And so I could do a lot of medical education for other healthcare providers, but also, as I think you and I probably connected on my public sort of outreach with YouTube and podcasts for patients, because there's just so many people frustrated with these chronic conditions and not getting help.
But interesting, you mentioned that a lot of the times that you're seeing mast cell is with patients with other chronic underlying conditions. So would you say that those go hand in hand?
Normally, yes. The way I characterize it to a patient, let's say we're first talking and trying to sort this out, there's two directions the body will go. One is a more limited, what I would call histamine response syndrome, where they're certainly uncomfortable symptoms and potentially dangerous, but they're more limited to the histamine family of responses. And then there's the more body-wide, and literally almost every cell in the body can be related or affected in mast cell activation or mast cell disorders. And those kind of take on an even bigger component, so that they have a histamine component, but then they have a whole lot of other immunologic dysfunction. And the longer your body tries to battle with that without help, then the more easily other illnesses or imbalances can affect your body, certainly. So I think it's a piece of a lot of chronic illness. I don't know if it's 100%, but it's a piece of a lot of chronic illness.
No, that's right. And I think a lot of people struggle to get a diagnosis because, like you say, there's just a lot of things going on.
This is probably one of the most frustrating things for people.
Mhm.
And what I'll tell you from the other side of the coin is it's frustrating for the doctors or other healthcare professionals too, because we don't really have the best tools to diagnose what's really going on with people when they have mast cell disorders. And part of that is simply just technology. And also, it's only really in the last 10 plus years where the medical establishment has even really recognized this as a problem beyond very tiny. They used to think it was, a fraction of 1% of people who had mastocytosis, for example, which is a higher level disease. What we realized after time was no, we just saw those people because the very crude lab tests we used to check for it could actually find it. In your case, probably, I don't know your history, but I know in a lot of my patients' cases, we do the standard testing and it might look fairly normal or totally normal, but obviously they have a lot of symptoms. So diagnosis first is very difficult in most standard systems, and I'm more familiar with North America, but I think in the UK, I have a lot of colleagues in the UK. You kind of either don't get any testing done or you get a little bit of testing, and the tests that are done are not very sensitive for what you've experienced, for example.
So diagnosis is very difficult, and I do hear that from the community actually, because I'm also a health coach, and a lot of the people I coach do have mast cell activation syndrome, and it is
Mm.
really difficult for them to try and find out how to manage their symptoms because, as you say, they've just become more sensitive over time, and suddenly they're reacting to everything. So, can
Yeah,
you just outline some of the alternative therapies that you would suggest that people try in the first instance?
sure. And I think what most people find, I'm sure you've seen this, is uh, although there's a lot more published now in the scientific literature about mast cell disorders, there's really a recognition that we have some drugs that can help, especially if you're in crisis. The drugs are probably better in crisis. There's some drugs that are used chronically, such as histamine blockers of different types. Um, but then one interesting thing in the mast cell research community is they're one of the few areas where in their publications they'll actually list what we would previously have considered alternative therapies. So things such as bioflavonoids and other types of plant molecules and nutrients and things of that nature. And I think what that speaks to is the frustration that the clinicians have because you can't, in most people, except for, say, an emergency situation, you can't drug away mast cell activation. You can calm it down with drugs, but you can't make the problem go away because the problem is much deeper. And so I'm working with a patient, and it's someone like yourself who's maybe there weren't lab tests, but the signs and symptoms are very clear. You have mast cell activation issues. The first thing that you have to consider is the triggers underneath. Okay. Now, those often are in two or three layers. One would be the peripheral layer, which are the things you notice. So it might be like cleaning products that are smelly, or other perfumes or something trigger people, or it might be a particular pollen that triggers them or something, maybe a food. Then there's a next layer, though, is why do those things trigger you? And then there's the deeper layer of is there a way we can access some of your organ systems to get them to calm down so they're not triggering all the time? So I always tell people we're going to work from the outside in to try and get things calm, but we also have to work from the inside out to get the reason for the triggering and the hyperreactivity to not be so hyperactive. And so when you're looking at, inside out, that's going to be things like potentially dietary changes or fasting protocols or some mixture of things like that, because your digestive system has an incredibly large population of mast cell and mast cell triggers in it. But from the outside in, uh, there's The way I look at it, there's sort of two pathways to helping people. One is working not as much on the mast cell family that's creating the trouble. That's the other pathway, but it's trying to help your body when you get this histamine released and glutamate and all of the other inflammatory chemicals that get released beyond histamine. It's a whole family. Um, how can your body get rid of those the quickest? Okay. So it's sort of like, all right, the bucket is full. While we work on stopping the bucket from filling up, can we poke a hole in it to drain it out, get your body to remove things? So a lot of times the the removal side is critical. And those are things in you look at histamine and then its related chemicals that create all of these inflammatory things. A lot of the removal is the same pathway. So it could be histamine or one of its friends, that needs to go out. There's a lot of enzymes that get plugged up or slowed down, you could say, that are a natural defense against, too much histamine or too much of the other chemicals. And when you get a big influx of mast cell disruption and dumping all these chemicals out, the body can't handle all of that. It's made to take care of some amount of toxicity, but not all of it. So things that help on the elimination side, specifically, a lot of B vitamins get involved in those pathways of removal. A number of trace minerals get involved there because B vitamins and trace minerals will go to the enzymes that are slow and make them kind of get back to normal speed. The other thing is and this is something I spend a lot of time with the healthcare providers on, your body actually has a very complex way with histamine of trying to get rid of it. So it has a major pathway that's very complicated, and we always try and give the nutrients to kind of balance that out. But it also has two other ways out. There's one that's more common now, people know about it, which the gut uses a lot, the DAO system, diamine oxidase. Some people take DAO supplements and that sort of thing. It used to be called histaminase, but technically biochemically they changed it to DAO, and now because people can buy supplements for it, they know about it. So that's a backup way, but that's a big way your gut is helped. But then there's also another one that is literally sort of an emergency relief pathway, totally different, and it's acetylation. Now, acetylation, and again, anything I say here is just for interest, it's not medical advice, but when we're working on acetylation, is a quick way to take histamine and a couple other really inflammatory things and move them to your liver so they can be removed, which is what you want. Acetylation runs with vitamin B5. So pantothenic acid, also known as vitamin B5, is very core to the acetylation enzyme system. People who are allergic, atopic, mast cell affected, that system just slows down and slows down and slows down. And what I'll try and tell, doctors or patients is you do better if you're helping all three pathways. So the DAO pathway is fairly straightforward. The acetylation pathway is pretty simple, but your body will burn up the vitamin B5. So, I'll have patients take extra vitamin B5. It's very safe. It's water soluble. It's not going to hurt you at all. And even 30, 40 years ago, before we really understood that pathway, it was common for integrative doctors to give vitamin B5 in allergic reactions and things, to help long term. And that we later figured out that's why it is. Now, the final pathway is the one everyone knows about, but it's got lots of steps. And this is where trouble usually starts with other problems you might have. It's sometimes called the histamine methyltransferase pathway or the HMNT. And what happens is the first step in the lung pathway is to methylate histamine. So that would be like with a methyl donor, like methyl B12 or methylfolate. And that's well and good, but that turns it then into methylhistamine. Methylhistamine is actually more toxic than regular histamine. And so your body has two more steps to get rid of it. What people will do sometimes, though, not knowing this and very well meaning, is they might take an active B complex that has methyl B12 and methylfolate in the B complex. They suddenly methylate their histamine, and then it gets stuck because it can't go through the rest of the chain. So if you've ever had that problem where somebody says, wow, my mast cell problems got way worse when I took active B vitamins, so-called, or, methyl B12 methylfolate. The reason is not because those were so bad, it's that your body couldn't get rid of methylhistamine, which binds much harder to your receptors. So thankfully, your body has a way out for this, but this is where the bottleneck usually is. The next step is a enzyme that's related to DAO. It's called MAO, monoamine oxidase. The reason that gets bottled up is MAO is used not just by histamine, it's used by estrogen and other hormones. It's used by a lot of the excitatory brain chemicals like dopamine and epinephrine, norepinephrine, things like that, and histamine. And so what'll happen is you got all these guys trying to metabolize through MAO, and then you get a histamine dump, and there's nowhere for the histamine to go. So you get all this really active methylhistamine can't get out. And this is why sometimes a little bit in men, more in women, because of cycling hormones, a shift in reproductive hormones can create more mast cell activation because too many people trying to get out of the same door there. The good thing is that the MAO enzyme is supported pretty simply. Its cofactors are vitamin B6 and magnesium, and then it's sort of backed up by vitamin C. So MAO and to some degree DAO, the gut one, can be helped again by B6 and magnesium. Just as a little side note, because some people get toxic with the old-fashioned plain B6, P5P is an active form of B6, and there's no direct toxicity with it. You can have other issues, but to help that system, that's why we always have people try and do a balance of the different B vitamins. But then there's one more step. It's a really complicated pathway, and this is why people get so many weird symptoms that are super unpleasant. When you get histamine dumps or other inflammatory dumps, you can get it through, and you get it through monoamine oxidase, and now it's not really a histamine anymore that's going to bind somewhere like methylhistamine. I call it the evil histamine would. Now you have just a toxin that has to have one more step to get rid of because it becomes histamine aldehyde. Aldehydes simply make you feel sick everywhere. Okay. They can give you headaches. They cause a lot of neurological inflammation. So whatever that does to you, it's very unpleasant. It can make you have body aches because the body, we make aldehydes, but we're supposed to get rid of them really quickly. Well, if I get all this histamine all the way through and now it builds up as histamine aldehyde, now I'm just sort of poisoned. And you could get fatigue from it, as I mentioned, headaches, but a lot of other either, sleeplessness or central pain type problems or agitation, all manner of things. The only upside with that is that, again, it's an enzyme. It just gets plugged up, and its helpers are two B vitamins. So vitamin B1, which is thiamine, which often people will see kind of the headline things, and they'll take B12 and folic acid for the first one, and maybe some B6 and magnesium. They forget about the other ones. Well, niacinamide and B1. So niacinamide is part of B3. B1 is thiamine. Those two together open the gates to get rid of the aldehyde form. And then your body can kind of take a break and at least be moving them out. So getting rid of histamine, but remember there's other chemistry. That's very important. And people say, well, I'm eating food that has B vitamins and I never had this problem before. Why now is it a problem? It's not that your system broke down. It's that the system is only made to handle so much. And
Yeah.
if the mast cell family is dumping histamine and inflammation out at a faster rate suddenly for whatever reason, that system just needs more support. So that's a big thing, getting rid of it. And it's got three pathways, a little bit complex. It's not so bad. And it's all pretty straightforward things that help out to get it out of the body. The other thing that people, because we call it mast cell disorder, mast cell activation, the mast cells are a type of cell that will get, activated to dump histamine and heparin and serotonin and all kinds of other chemicals. And they're supposed to do that for immune reasons. They lose their way in mast cell activation. but there's three other cell groups that get involved. So it's not mast cells get blamed for everything everyone else does. So your basophils and other immune inflammatory cell, they dump stuff. Your eosinophils dump stuff, and then a cell type called CD40 that is responsible for B cells dumping out IgE, which triggers your angioedema and all of the other things. They all work together, and they all trigger each other. So if you have a regular old allergic reaction, the mast cells probably are the biggest contributor. When you have mast cell dysfunctions like mast cell activation disorder or any of the other mast cell problems, all four cell types get involved. And like I say, they cross trigger each other. So you can't kind of calm them down. So getting rid of histamine is a big deal. Then you have to look at what can I do to calm these cell group down? And then that relates to either trying to block receptors, which is more of the drug categories, or trying to tell the mast cell family, as we'll call it, that they don't need to be hyperactive. Okay. Flavonoids do that. People, we hear about like common ones are like chromalin, histamine. Chromalin's more of a drug, but it's just a flavonoid. Histamine, lutein, there's lots and lots of flavonoids. So they're helpful. But again, if that's all you do, often it just kind of slows it down a little bit. Then when you get down, to a deeper level, like I say, then there's more, what can I do with my body to tell this system to just chill out, right, a little bit. And that's when things like dietary alterations and those sort of things can go on. And that's sort of a whole deeper level to get at.
Okay, that's really fascinating. Thank you for all that insight.
It's a lot of detail. Sorry but that's how it is. Yeah.
It's definitely above my level of understanding. But interesting you say about the different triggers. So for me, a couple of years back, it was with paint. So I'd never been allergic to paint before. We'd painted our living room, and suddenly it was an airborne issue in the house. I did try some blockers as well, histamine blockers. So fexofenadine was one that was prescribed to me. But as you say, drugs, they can sort of support you, but it doesn't address the underlying cause,
right,
which is what I found. So after a while, I was reacting to foods, to even supplements. So you mentioned supplements, but there can often be fillers in those supplements.
Yeah.
And I know, as I say, from speaking to members of the mast cell community, this is one of the issues they have. It puts the fear in them to take anything else or to try different foods. So, but I did try everything that you mentioned, actually, around trying to have this multifaceted approach, I guess. So it's controlling the histamine. So what I did is to try and suppress the flare is I got kind of fed up with having to go to doctors, no one listening to me whatsoever. So I actually decided just to go on a water fast because I just reached my threshold for, this flares. I just thought, I cannot handle this. Let's see what happens. So I lasted 7 days. The angioedema completely went away and it reset my body. All the inflammation went down. And then once I'd done that, I realized I need to be careful now. This thing has gone away. I need to now be mindful of what I'm putting into my body. So I actually went really low histamine. And then from that point of reset, I made sure not to activate those mast cells again. And so it was the supplementation you mentioned, the antioxidants, the phenols, bioflavonoids, curcumin, I was taking quite regularly. And then I was doing a lot of saunas as well. I was going quite regularly to try and sort myself out because clearly there were underlying issues. And then I also eliminated grains for a whole year. It was pretty tough to do, but yeah, I managed it. So no wheat, no oats, because during my flares, I found that I was really reacting to them. It's been a year and I haven't had any more flares. And previously, in the last 2 years, I was getting them every few weeks. It was allergic to something else. Every week, I was thinking, oh, I can't eat nuts anymore. I used to eat them all the time. I just couldn't figure out creams, anything topical. So yeah, what you said really resonates with me. And I did actually try all those things. But I know that, I say, other mast cell activation syndrome sufferers, they would be reluctant to try most of these things just for the fear of, as you say, a flare coming back. Like you said, if you don't remove the histamine. So it's really trying to do all those things at once if you can. I know it's not easy for people out there, but it seems to be a good approach.
Yeah, I make a really good point that about supplements. Because I know in my most reactive patients, one filler that they're sensitive to will totally, flare them up. And there's a lot of fillers that are put into nutritional supplements. Most of them are on the label, some are not. So you do have to be extremely careful because a lot of times it may not be, let's say you had a vitamin B5 supplement, but it had a filler that was made from corn or some other, soy or something, or a filler that had a lot of chemical with it, which that happens a lot with especially big commercially made supplements. They're made in bulk and there might be a lot of, toxin sort of along with it. So people will get a flare and then they'll say, oh, well, the B5 caused me to flare. And in
Yeah.
about 60, 70, 80% of the cases, it's actually something in there with it. So I'll usually tell people to look, and I don't know if on your forums people have come upon this, but there are some, there are not many, but there are some companies that actually make things with little to no fillers, and that can be much safer. The dietary change, as I said, is sort of like it's almost like the foundation if you can get there, you know. And people a lot of times, and of course, if someone's going to do a fast, they should talk to someone who knows about fasting. But if you just think about the mechanics of fasting, it literally can reset the level of sensitivity of the mast cell family and a bunch of other things because you're no longer kind of putting anything other than water through your system that's going to poke on the mast cell family and make it, react. That phenomenon you mentioned of, well, I've always eaten nuts and now nuts bother me or greens or whatever. That's frustrating. It's also very common. And it's not so much um, you have a lifelong problem with that food, but whatever it is, you keep ratcheting up the sensitivity of the mast cell family, and they're just going to react to everything. And so, I mentioned at the beginning, we would see these patterns before we had a disease called mast cell activation. And a lot of times the base treatment would be to do some kind of a fast with a person or a rotating fast if they couldn't do a longer fast, just to try and reset them. And then, as you kind of mentioned in your story, then suddenly they may tolerate other treatments better, you know. Um, I currently have a patient who has all of this going on with mast cell and histamine response, et cetera. But then they have a severe autoimmune disease, and then they were exposed to mold mycotoxins. So they sort of have three inputs in their poor immune system. So they would take the best thing to try and calm the mast cells down, and they actually react to it because they're just being assaulted from too many directions. Um, Things like fasting literally can reset your immune system. And again, it's not that you have to fast forever and you need to find a safe way to do it, obviously. But the more you can do it, it just gives it a break. And so the signals that go to the mast cells and their relatives slow way down. So then the mast cells calm down. Then when you bring foods back in, you might notice some you react to more than others. But when you bring foods back in, they're not as triggering to everything, you know. And in your story with the paint, and the volatile organic compounds that come off, and then you were staying inside because you thought maybe it was pollen or something. Um, it's not uncommon to hear that where, I never had a problem before, but then I was exposed a lot to something. Maybe you didn't even know it. You did, you figured it out. But we see that pattern a lot. And it's just like the best analogy is that you have a bucket that can hold inflammatory things like histamine. Once it overflows, it doesn't matter what makes it overflow. Everything makes it overflow. So, fasting can be a way to drain the bucket. All these pathway supports can be a way. The flavonoids and phenols can be a way to just kind of calm things down. And yeah, if you're having anaphylaxis, you probably need medications to not, to not have that go on. But the medications for the most part are more like an emergency brake. They're not really going to get at the underlying problems. So I think was there, I'm curious because I've heard the same kind of pattern with others. Was there anything that triggered you to say, I'm going to do a fast other than just there's nothing else is working and I'm just going to do a fast?
It's a really good question, Dr. Anderson. So, going back to the medications, the doctor did prescribe me prednisone. Over the second year with MCAS, like I said, I was reacting to so many things, even say, cosmetic products and sunlight. I went out in the sun and my skin erupted in hives. It became so chronic and relentless. I realized that I was just adding more fuel to the fire. And I didn't want to suppress my immune system. And I had done some online research myself around because I thought I just had allergies. I didn't know it was MCAS. And I read
Sure.
some recent studies, scientific published papers that said that fasting can help reset the immune system and reduce inflammation. I knew I had a problem with inflammation because of the chronic, as I say, attacks. And I am aware that chronic inflammation can lead to things like cancer. So it was just kind of a last resort. I didn't have any other medications I could take. The doctors didn't know where to send me on that kind of medical pathway.
Yeah. So in your own journey, you did a 7-day water fast, is that correct?
Yeah,
And then did you do any other fasting after that, or was it that sort of a good reset for you and then you were able to work forward?
that was a perfect reset, I have to say.
Yeah, that's that's very good. It's also amazing. Yeah, as you said, definitely, if you're going to do any fasting, you should speak to a healthcare provider, ideally someone who has helped people with fasting, because sometimes the general practitioner, they may understand fasting, but not know anything about, when it's good and when it's bad. But yes, if you're, sometimes people with blood sugar irregularities and other things, they have to be very careful. And you do definitely want to remember that you'll have more likelihood of flares in the first day or two. And that's just naturally your body is dumping more out. One of the things that is theorized anyway, as far as a fasting benefit, is because the GI tract has its own nervous system, it also has its own immune system, and those two things talk to the whole rest of the body and back and forth. The GI immune system, as we mentioned at the beginning, has lots of mast cell and mast cell relatives in it. And that's largely there to protect you from food you might eat or toxins you might ingest or something that your immune system should know about and deal with, right? When you get mast cell activation syndrome or mast cell disorders, that system, everything can trigger it, literally, because it's confused. It's very kind of overworked. So the fasting, in a sense, rests the GI immune system, which then tells the rest of your immune system we can all calm down. And so that's one of the mechanistic ways that fasting can be helpful. The other thing is, after the first day or two, when you're fasting, your body, especially your liver and your kidneys to some degree, but also fat cells, et cetera, will start to get rid of toxic buildup. So remember in the beginning, we said, well, if the bucket's full and we give support to the enzymes, that's to help, kind of drain the problem. Your liver, especially in other organs, will start to do that faster all on its own because there's nothing new coming in. And that's another way I think that the reset can be very good, because your poor immune system and your liver cells and your gut, they're always at 100% full, and until you do something to get rid of stuff, they're just going to react. And then every week you're reacting to more things, unfortunately. Yeah. So that's an amazing. I'm glad that you came upon that, because I don't. You probably didn't have any of your doctors tell you to try that, I'm guessing.
No, that's right. And
Yeah.
I actually went to the doctor shortly after that because, like I said, with the mast cell, there was a chronic UTI. So they wanted to check if that was still there, but they found ketones in my urine sample. And I
Sure.
was told I need to eat carbs immediately. My ketones are too high. Go home and eat carbs was what I was told. But yeah, I didn't follow their advice. I appreciate that other MCAS patients can't fast. Like I say, I have spoken to some and they just, it's not an option for them for whatever reason. But if that's not an option, you mentioned about just reducing that histamine load. So what's the next best thing they can do other than the vitamin supplements that you
Yeah.
talk about? Is it just stopping the histamine being ingested?
Yeah, so there's a couple of things that can be done. It's just not, and medically sometimes it's impossible for a person to fast very long. The first thing I will have people do, and again, I tell them that this should be kind of like a 7-day fast would be this should be something you do initially to try and drain the bucket, not like it forever. Okay. But and nowadays you can get pretty good information online about high histamine foods. So you definitely want to have as low a histamine diet as you possibly can. Now, if that's the only thing you ever do, you might have to stay on it for a very long time. But it's the next step from fasting to go on a low histamine diet because then at least you're not triggering your gut immune system to dump histamine and you're not, marinating yourself in it. So that's one thing. The next thing is, in addition to the gut immune system, our so-called good bacteria or good flora in the GI tract, when you have mast cell problems, they get very off track. And a lot of times bad, organisms will overpopulate. So you have to be somewhat careful about especially simple sugars and sort of because on a low histamine diet, you could eat a real high carbohydrate diet. And that may or may not be bad for you, but it's not going to be good for the bacteria that are in the GI tract because they metabolize the carbs. The problem is that the longer you've had mast cell problems, the more of inappropriate bacteria grow in the digestive tract. And they literally then can trigger histamine responses all on their own. So things like low histamine diet, and when you look at carbohydrates, the ones that have more natural uh, not just fiber, but like polyphenols or flavonoids, it's the colorful, nutrient dense part of plants. Those slow that reaction down. They won't trigger the bad bacteria as much. So you can have a carbohydrate, but it's not like you ate, a simple carbohydrate that had no flavonoids or phenols or other stuff in it. Um, the next step usually then is seeing if once things calm down, and again, when you go on a low histamine diet, sometimes your body will perceive this danger signal, and the first day or two, you may actually be more reactive. So again, you kind of have to work through that for a few days for some people. But then the next thing is sometimes there's residual foods you still probably shouldn't eat. So once you sort out your low histamine diet, if you have days where you flare, maybe take a look at what you ate that day. And it might not be a real allergic reaction, just might be a food that your gut's not ready for, you know. And that could be anything, literally, that one might eat. So low histamine diets can be the next best thing to a fasting state. You mentioned sauna, doing a lot of sauna, et cetera. Sauna is one of those things where you get a direct, obviously, we usually sweat in a sauna. Most people do. Some people don't, but most people do. Well, that's a way out for a lot of toxic things. And what sometimes people won't connect up is the toxic things that come out through sweat. A lot of chemicals, some metals, some other things that leave. They are also triggers to mast cells. Okay. It's not just, foods and maybe pollens or something like that. Chemicals are huge triggers, sour metals, other toxic things in your world. So again, the sauna and a lot of people, just as a safety measure, if you're real toxic, you might want to start with very short sauna sessions and work your way up because you can feel pretty sick if you over sauna. But the sauna can help like get rid of the other junk that's triggering you, so that and a low histamine diet kind of work in the same direction. Now you need to stay, as you probably learn, very hydrated when you're sauning and because you have a lot of water leaving your body. But sauna can be a really wonderful thing. um, I've had patients, just because some people will find this, they just they don't have some place they can go to do a sauna, or they don't have one at their house. They just have no access. It turns out that anything that makes you sweat is pretty much almost as good as saunaing. Not quite, but almost. So I would have those patients, I would say, well, can you go out, say for a walk, or maybe can you, do something in your house, or get on a treadmill or a bike? And I just tell them, put one extra layer on from what you would normally wear so that you sweat. And if you can get yourself sweating, you'll still dump the bad stuff out. Um, Sauna, as opposed to just plain sweating, may have one benefit over plain sweating, but plain sweating is better than nothing. The benefit sauna has maybe beyond that is, depending on the type of sauna, you can also get a little deeper response in your body. Your mitochondria can start to kind of clear junk out, some kind of important deeper things that go on too. Sauning or sweating with good hydration, low histamine diet, watching if there's any patterns for foods that trigger you, and just leave them out for now. Um, and then doing that till you feel a little more stable, and then adding in, as you mentioned, some of the non-vitamin mineral things like curcumin can be extremely good, you know, um, bioflavonoids of many types, polyphenols. These are all plant compounds that are very helpful. The other thing is, because people, so I've had this with patients where they'll say, well, I'm like, I spent all my money on doctors, and I'm out of money. I can't afford good curcumin, which it can be expensive. In many of the studies, curcumin has, over 100,000 published papers all about how it does stuff. But in many of the studies that relate to toxicity and mast cell activation or histamine, they actually just used plain turmeric, which is where curcumin comes from, the root. And a lot of times at grocery stores, you can get plain turmeric root, and you can literally just grind it. And if you like it as a tea, you can do it that way. But I try and get people just to put it in their food, because one of the things we forget about is, if turmeric doesn't absorb in the bloodstream terribly well, but actually we want it to calm our mast cells in our digestive tract. So plain turmeric works really well. Now, if you haven't developed a taste for turmeric, you have to get used to it in your food. But just grinding fresh turmeric into your food can be a wonderful thing. It's way cheaper than supplements. And as a base, it can be really, really, I've had people where that's really taken their gut reactions down, a big notch. Certainly if you're taking curcumin, you can just keep doing that. But, everything, as I know you're acutely aware of, and I am too, all these extra things do cost money, and not everybody has lots of resources. So if you can start with things like manipulating your diet to a low histamine diet, you can probably do that paying for the same amount of different foods that you would normally eat. If you can incorporate something like buying a turmeric root, once or twice a month, that's usually doable for folks. Get yourself sweating somehow. If you have access to a sauna, great, use it. If not, bundle up and make yourself sweat. And those things, I think those are real base core level things. And then the other stuff will get more mileage out. It'll work better, if you add some nutrients to support histamine removal, for example.
No, that's great. And I'm so glad you brought up the fact that not a lot of people, especially MCAS sufferers, can afford, or they don't have the resources to try out these, alternative therapeutics.
Mhm.
Because it's considered a disability and it can be really debilitating. So a lot of the mast cell patients I speak to, they cannot work. They
Mhm.
are very immobile. So I'm glad you gave them alternatives that they could try at home, and things they can do
Yeah.
for themselves to better their own care. So thank you for sharing that. And you mentioned about detox pathways a lot in your other videos, which I will link actually as part of this
Mhm.
one. I thought that was amazing that you shared that information,
Mhm.
sweating, but there's other ways to open up detox pathways, isn't there, as well? Could you just elaborate a little bit on that, please?
Yes. If you kind of think of the examples I gave earlier about histamine being removed from the body and the three pathways, well, if you take kind of a step back away from that, your body in the liver, the digestive tract, a little bit in the kidneys, and a few other, organs around the body. It has a, a more macro, more global set of pathways to get rid of toxins. And again, it can get overwhelmed, but it basically is broken into three sections. And so there's phase one detoxification and phase two, which are kind of the famous ones. And most people have maybe heard of those. You can look them up and they'll have little pictures of livers and stuff on them. But phase one is made specifically for more complex chemical and hormonal and other toxins. So these would be things that are more fat soluble. So that could be your, paint exposure, paint fumes. It could be hormones, either, the ones your body makes, or maybe you got to, you really, I've had a patient, more than one patient, I've had patients aggravate when they had no problem before, and then they went on oral contraceptives, which are different type of hormones, and then they had trouble after that. Again, it's something for your body to detoxify. So it's just more than you could handle. So phase one is about more complex molecules, and then a lot of other toxins beyond like paint fumes, like pesticides and herbicides and things. So phase one uses a system to take those big cumbersome molecules and run them through a couple of chemical steps so that they become more they're non-water soluble and they become closer to water soluble. Okay, because your body can get rid of water soluble things more easily.
Okay.
Phase two, if phase two didn't exist, you would just be toxic all the time from phase one because it gets stuck, right? Phase two are things that we've all heard about. We might not think about the main part of phase two, but like when I teach medical students, the first thing I tell them is just think of phase two as it puts anchors on these big molecules and helps your body usually urinate them out or get them out in the feces or sweat, right? Phase two includes some famous things like glutathione, for example. It includes some of the enzymes we mentioned for histamine, like MAO and DAO, to the addition of something to get rid of bad guys. It includes lesser known things like glycine and other amino acid, and the acetylation pathway I mentioned that helps get rid of histamine. It does other toxins. So there's this whole family of phase two things. They get these bad guys and they just grab onto them and basically put like a little metabolic anchor that says, okay, if you're in the plasma of the blood, we're going to urinate you out, or we're going to send you out in the feces or sweat you out, right? This is why that helps. So glutathione, often people will use, glutathione and some of the other B vitamins. That actually helps phase two do its job. And then phase three is literally making sure you have enough to get it out of the body. So for example, dehydrated people, a lot of mast cell patients are very dehydrated because of all the inflammation and everything. When you get dehydrated, you can go through phase one, phase two, but then the chemical and its little anchor don't have enough fluid to be urinated out or sweat out, or maybe go out in the feces. So phase three are basically those three big ways. You also breathe things out as well, but sweating, urine, and feces are the way out. So you have to be hydrated enough to move them all the way out. For sweating, you have to sweat. That's why sauna and sweating is good. But on the base level, enough hydration and enough food that has fiber in it so that it can be carried out through the GI tract if needed. That's phase three. So phase one, generally, unless you have certain toxic problems, phase one kind of operates on its own. It needs some trace minerals to help it operate, but it's generally self-supporting. Phase two does require a lot of B vitamins and glutathione and some of those things that do come from your diet, so that's good. Sometimes extra are required. And phase three literally is just enough water in your system and fiber to make sure you either sweat it out, you're out, or it's carried away in the feces. So those are, like I say, those are big picture detox pathways that are famous in the liver, but we do them kind of all over the body. And if you think about it, those are other things that will fill the bucket up. So then the mast cell activation is big much, and you're activating all the time. So again, the more we do to help our body get rid of junk through those three pathways, the better, the less the bucket's full, right?
Wow, that's a lot of information there. Thank you so much for sharing all of that. So, I mean, my goal is going to be not to activate those mast cells ever again and to kind
Right.
of keep them under wraps. So, I think going forwards, I'll still keep practicing a lot of these things,
Mhm.
even though, as I say, I'm currently in remission. And so, on that note, would you suggest that other people do the same if once they're in remission, just to kind of keep the detox pathways open, make sure you're eating correctly, avoid exposing yourself to too many toxins?
It's yes. The short answer is that usually once you have mast cell activation of any kind and you get back to pre-mast cell state, in remission, et cetera, it's not a long distance to kind of activating again. So if you leave behind the good things you did to kind of get you there, your body eventually the bucket will fill up again, and then you'll be in a cycle of doing that. So yes, if you can get to low or no symptoms, keep doing all the good things, and those can be very basic dietary oriented things, and getting enough nutrients to run the detox pathways and all,
Yeah.
all the things,
Yeah.
and sweating periodically, et cetera. Those are more health maintenance at that point, and you really don't want to back. I mean, anyone, as I've had it personally myself, anyone who's ever had mast cell problems, you don't want to go back there if you could possibly not go there. So it's worth a little of your own health maintenance to do that.
Lots of other people should consider their environment also, not just the diet aspect.
Yeah, I think that's an incredibly important part too, is, once you kind of handle all these things inside you, remember we live in a world that has, 100,000 chemicals that didn't exist 70 years ago, right?
Yeah.
And a lot of them are in not just the paint and things, but they're in our cleaning products and our bathing products and, you know, everything. We're just surrounded in them. And you might not be able to control maybe what's at your work, but you can control what's at your home, and in your car and elsewhere. And that, again, every little thing you can do not to fill the bucket up is the goal.
Yeah. No, that's brilliant. Well, I just want to say thank you so much for your time, Dr. Anderson. I very much appreciate it. I know you're very busy with all the education work you do and with
Yeah.
all the patients that you see. So, yeah, thank you so much. The information you've shared today has been absolutely invaluable. And I'm sure a lot of people suffering out there will be able to take something away from it.
Thank you very much for this was fun. Thanks for having me.